Okay, let's get started. We're going to be looking at some animation for the insertion of the Bryan cervical artificial disc. What you see first is a degenerated cervical disc, much like what you might be seeing as a surgeon in the spine. And you can see we're removing some of the arthritic bone spurs on the surface of the anterior aspect of the spine. Shortly after we do that, we insert one of the instruments to help us with the placement of the distraction screws. The screws have to come in at an exactly true space. They have to come in perpendicular to the spine, and we use a bubble to help level that. And then we have another instrument that helps us with placing the hole for the distraction screw a set distance away from the actual disc space itself. Now you see the insertion of the actual distraction screw in the top and the bottom vertebral bodies, and they have to be placed at the correct distance and angle. Now the distraction device comes in and we're opening up the disc space, and now it's time for us to do our job of cleaning up and evening out the end plates, removing any osteophytes, removing any bone spurs, opening up the area over the dura in both foramen, and then ultimately placing the distraction drill device. Now what we're doing is sizing for an appropriate size for the artificial disc itself. It has to be at an appropriate height, width, and length. And once we see that we have an appropriate size, or whether we have some binding, we sometimes have to go back and take the drill and improve the concavity so that we have a nice, flush, parallel concavity that allows the artificial disc to sit true. Terribly important and something that will be moving for many years to come, that it's inserted in absolutely the correct fashion. Now we see the milling portion of the artificial disc technique placement. We're creating concavities in the inferior and superior surfaces of the actual disc, because these concavities will actually hold the artificial disc itself. Now you've seen the placement of the artificial disc, and it's in its place, ready to function normally with correct flexion and extension.